Vibrio cholera. It's a genus Vibrio, which are all the species in the genus Vibrio are highly motile cells. The Vibrios ferment on selective media. They possess ONH antigens and membrane receptors that are going to resemble those that you can see in other Enterobacteriaceae bacteria. Think E. coli's. But Vibrio cholera is going to come in two major types. The classic Vibrio cholera and a subspecies known as L. tor. Once ingested, the incubation period for Vibrio cholera is anywhere to a few hours to a few days, depending upon dosage, age of the patient, health of the patient. It's going to be a fast onset once the incubation period, or whatever it's going to be for that patient is. It's going to be a fast onset with, they say, call it abrupt symptoms. Suddenly going to have vomiting, followed by copious amounts of watery feces. Okay, they refer to this as secretory diarrhea. Many old textbooks use the layman's description of rice water stool. There's going to be so much liquid coming out that it's quickly going to lose all coloration from any of the feces or, any of the food products still in the large intestine, and it's going to go clear very quickly. Okay. Diarrhea that you've probably had in your life, okay, that's on the low end of copious. Here, Vibrio is going to be on the fire hydrant end of the spectrum, okay? Because, look at that next line there. Fluid loss of 1 liter per hour, okay? 1 liter of fluid. For those of us who are American, half a gallon. Half a gallon of fluid is going to be exiting out your bum for every hour. There have been reports of patients who, untreated, because for whatever reason, the part of the world they're in didn't have, medical facilities to be able to handle, treating cholera, or it's overwhelmed with treating cholera, because as we're going to see, cholera outbreaks are quite prevalent. But there have been records of patients losing half their body weight within a couple of days just from the fluid loss due to the diarrhea. Because the diarrhea is so extreme, because the fluid loss is so extreme, they're also going to be losing blood volume. They're going to be not only pulling water from the surrounding tissues, but they're going to be pulling it out of their bloodstream itself. This is going to throw pH levels. This is going to be throwing electrolyte levels way off. They're going to start to suffer muscle cramps. Their skin's going to become flaccid because, well, there's just no fluid there. The tissues underlying the skin are going to start to thin out, and the skin's just going to kind of hang from them. The sunken eyes, again, tissues that support the eyes in their eye socket are going to shrink from dehydration. Then there's going to be coma, convulsions, and ultimately death. Because of the loss of fluid, because of the blood volume loss, they're going to start showing the beginning signs of shock. Hypotension, meaning that their blood pressure and their cardiac rhythms are going to start to go off a bit. And this is quickly going to be followed by the full shock will finally set in. Remember shock, blood pressure drops, heart rate skyrockets, um, altered state, followed by coma, followed by death. Once the onset hits of cholera, because after that couple of days of incubation and it hits, death could happen within 48 hours. And the mortality rate is going to be 55 to 70%. That's even with treatments, because this is going to hit, this is going to overwhelm so quickly. Saving grace is the infectious dose, 10 to the 8th. Okay, that is 100 million bacteria. Okay, 100 million bacteria in one dose. Boom. Vibrio cholera passed through by the stomach, and where the duodenum, jejunum, right in that area, will begin to burrow into, penetrate the mucus lining, the epithelial lining of the small intestine. They begin by adhering to the microvilli, because remember, the epithelial cells of the small intestine have microvilli, which increase the surface area, thus increasing the ability to absorb nutrients. They will penetrate into the cells, pass through the cells, and then invade the underlying tissue. The main virulence factor that causes us the most of the damage from Vibrio cholera is due to the cholera toxin. You'll see it, the acronym CT, in textbooks, medical textbooks, and in the published literature. The cholera toxin gets into the cells. It's excreted out by the Vibrio cholera. It adheres to neighboring cells, and the cells that it adheres to, part of the toxin will then penetrate into the cell, and it will begin messing with intercellular pathways. It will cause the cells, the epithelial cells, instead of pulling in water from the food as it passes by, it will cause them to begin excreting water, basically reversing the flow. So now the cells start to pull water from the underlying tissues and excreting it out into the lumen of the small intestine. Epidemic outbreaks seems to be the modus operandi for Vibrio cholera. It's a fecal oral. So somebody who's sick, their feces gets into the water table, gets into the water source for that town, that village, that city. Either due to a lack of sewage control or a breakdown of sewage treatment. Vibrio cholera is still one of the main killers. Top 7 causes of morbidity and mortality. Morbidity is disease, mortality is death due to disease. It's endemic in regions of Southeast Asia and regions of Africa. Again, it's one of those childhood diseases that young children are either going to succumb to, or they're going to be able to handle and then continue growing, continue maturing. It's going to, come back and hit them many times later. Don't take my word for it as rote here, but I do remember reading it seems to hit the young harder, and if they survive the later instances while still damaging, still having a high mortality rate, the mortality rate for a teenager and an adult who's being exposed again, this is, a subsequent exposure, is less than, if they were an infant or a young child. It's relatively uncommon here in the US nowadays. Um, Rural areas of the US use septic systems. Um, we have been segueing to municipal water sources. There are still areas where, wells are the source of water, but local health departments have a tendency to check on those um, quite often. Um, Septic fields have to be laid out in certain ways, certain distance for wherever a well will be drilled. Trying to separate sewage, untreated sewage, from that house's water source. Nowadays, we're trying to get, like I said, more towards municipal water sources where the water is going to be treated and chlorinated to reduce the chances of outbreaks. Um, Wild West times here out west, um, even back east on the eastern seaboard, in the big cities like New York and Boston and whatnot, had typhoid outbreaks. I'm sorry, not typhoid. Yeah, had cholera outbreaks. Sorry, I said typhoid. I meant cholera. So cholera was a big problem here, probably up late 1800s, early 1900s. And then we began switching over to better water handling. Um, we still have had, up until about mid 20th century, mid 1900s, small little outbreaks of cholera here in the States, but nothing like it used to be. And I can't think of one that's been here in the US in the past 5 or 6 decades. Best preventive, keep sewage and municipal waters separate. Clean, treat the waters. There are vaccines available if you're going to be traveling to an area where it's endemic or there's a chance you could be exposed. It is a good thing to get the vaccine. The vaccine isn't to cholera itself. The vaccine is to the toxin, the cholera toxin. So you get a vaccinated with a toxoid. They take the toxin and they break it down into its parts. So your immune system can learn the parts, so you can mount antibodies to it, antibodies that could help neutralize it and keep the help reduce the time the toxins are in your tissues. There have been accounts that I've read that have talked about people, being treated with cholera, and around the world, and there will be a cholera wards, and you'll see the beds in these cholera wards will not use linen, will not use cloth sheets. It will actually be plastic sheets draped over the beds to help try to contain all the fluids. And for the more severe cholera patients, IVs going into both arms and into both legs as they're trying to replace fluids. Some of the bags, the IV bags, will be saline, some of them will be plasma as they're trying to get the blood volume back in and try to rehydrate and get the electrolytes back before there's kidney or neural damage. Nowadays, they're trying oral rehydration. Okay, um, an oral solution, a water, an aqueous solution that has lots of sodium chloride, sodium bicarbonate, potassium chloride, all of that try to get that orally that way to replenish fluids, replenish electrolytes. What they're trying to do is, if you look at those numbers, 100 to 400 mLs an hour. Okay, that is what, about a quart, just under a quart of fluid orally an hour. And as long as they can get the diarrhea in check, so they're not losing copious amounts that way, they could rehydrate the patient within a few hours. This is good for many of the developing, or what they also refer to as third world countries, that lack a medical infrastructure. So you're not going to have hospitals, you're not going to have hospital wards where there's lots of IV bags that you can start just, pumping IV fluids and plasma into a patient. You could be out in the middle of nowhere, little rural clinic, and what you could just take is some boiled water or some distilled water. You can boil water, or if you can get distilled water, treat it with chlorine tablets, whatever, kill off whatever's there, and dump in tablets, sodium chloride tablets, sodium bicarb, potassium chloride, glucose, whatever. Dissolve that in water and just have them start sipping continuously on the cup. So here, US, somebody has cholera, they went someplace and they came back after their trip and they're starting to show signs and symptoms. Yeah, you're probably going to do IV. If you're in a place, you happen to be a clinician who's, Doctors Without Borders or whatever, and you come across, and well, here you go. Salt water, sodium bicarb, sugar, salt, and just have them start sipping on that. Here in the States, Vibrio cholera, we don't see that often anymore. What we do see are other Vibrio species, Vulnifificus and Parahemolyticus. These are going to be exposure to seawater. Somebody's out swimming and they get a mouthful of seawater, okay? Or eating contaminated shellfish. You got to remember, people love oysters, people love scallops, but they are filter feeders. Anything flowing by will be drawn in by the animal, because remember, they are animals, drawn in, and everything filtered out. All the single cell eukaryotic organisms, all the prokaryotes. So Vibrio, it's going to be one of those that they're going to filter out and try to use as a food source. You come in and everybody loves raw oysters. Little Tabasco, little horseradish, yum, yum. Well, you're also eating whatever they filtered out. And if they filtered out some enterics or some Vibrio, you just ingested them.